Good afternoon, everybody, and welcome to my channel. If you're new here, and if you're not, welcome back. Today I want to go over the lupus. This is the subject that I will be covering today. I didn't go. I had a doctor's appointment with my rheumatologist a little over a week ago, and she's come to the findings that I do have lupus. This is 100% lupus now. Before, we were never sure. I just said I had lupus because I know other people that have it. I have all the same symptoms, but you can't really say you have lupus until you have it. But yes, I was diagnosed with lupus about 10 days ago, you guys, and it sucks. But at least now I know that I have lupus. She told me that with the blood work and the findings, she's still not sure about Sjogren's. And I told her that I'm always thirsty, and she said that lupus patients get thirsty as well. And she said I don't have the dry eyes like the Sjogren's patients do, but a lot of people who have Sjogren's don't have dry eyes. So I really don't know how they categorize that as to if you have Sjogren's or lupus. So my primary condition is lupus, and if they ever diagnose me with Sjogren's, it will be my secondary condition. So we finally found out after over a year, because I started going to my rheumatologist back in February of 2019, I believe it was 2019 or 2018, I don't even know, but it's taken this long to finally figure out that I have lupus. And I knew it. I knew I had lupus, but I didn't, I know I posted it, that I've had it and everything, but I just wasn't sure. But now we know. So, comes to this video, okay? I am in pain constantly anymore. My hips have been so bad, you guys, that when I get up in the morning, I can barely move them. That is probably my number one symptom that I'm going to complain about. Is always my hips. Back almost probably 8 months ago, my right shoulder, I could not move my right shoulder. I could not move my right arm. And I told her, I said, I don't know what's going on with my shoulder. It's in so much pain, I can't move it. It's almost like it was frozen or locked. Well, she gave me a shot in my shoulder. It was a steroid shot, and it did help. I can move my shoulder now, but the pain is coming back. And I think the reason the pain is coming back into my shoulder and my hips as well, and the bottom of my back, is because I'm taking care of my boyfriend's mom. She's been staying with us a week now, and it seems like my body has gone downhill this past week. He works. His sister, husband, and their son can't do it because they all live in the same house and they have coronavirus. So if anybody knows like the incubation period and how long everything is, I'd really like to know, because they just found out last Friday that they tested positive for it. All three of them did. They all tested positive for it. And they had the symptoms for probably 3 or 4 days before they were, diagnosed with it. But anyways, back to my lupus, you guys. I'm losing, I swear, I gotta sit up straight. I'm leaning back. I'm losing more and more hair all the time. When I am in the shower, it just seems to fall out left and right. But it still looks like I pretty much have almost a full head of hair, which is really good. My teeth are bad. They've been hurting. This one of these back teeth, I don't want to show you my teeth, guys. One of my back teeth have been hurting really bad. And I've noticed that my mouth is always dry, but I've noticed that when my mouth is dry, I get all the sores in my mouth. I tend to get them right in here. I get them up in here. I get them on the side of my mouth, on the gums. I don't get them like way up in the roof of my mouth. And right there on the tip of my tongue, I've had 3 of those little bumps, 3 or 4 of them. They have been hurting so bad these past like 4 or 5 days. And then I had a little like, you know how you get those corner sores? And I had that. I don't know if that has anything to do with the lupus or not, but I hadn't taken my B vitamins in days because I keep forgetting to, because I haven't been taking well care of myself, you guys. I really haven't. And I know with us lupus patients, we have to take care of ourselves before we can take care of others. But I have like that, what am I thinking? What word am I thinking? I feel like I have to help others before I help myself. I'm very, very, very selfless. I like to do kind acts for other people. So it's not going to happen anymore. I'm taking care of myself. I need to. And I need a shower. I haven't had a shower in 3 days. And I'm sorry I'm talking very low, you guys. But I should be talking louder. But she's downstairs right now. She's sitting, she's watching TV. I can see her through the baby monitor. I just don't want her to hear me, you know, making a video. Kind of awkward, you know. If I was home by myself, I'd be talking much louder, and I wouldn't be up here in my bedroom. Anyways, I really, really think I've had lupus since I was very young. Probably at the age of 10 or 11. I mean, I don't know. Can you get lupus at that young of an age? If anybody knows, could you please leave a comment down below and let me know how old you were when you were diagnosed with lupus? I mean, I'm 50 years old, and we've been trying to search for an answer for years on my pain. Years. So now I know why my hip hurts all the time, because of the lupus. And they say that's like one of the worst joints for joint pain in lupus patients is your hip. And I didn't know that. I did not know that. So my neurologist, my rheumatologist has put me on Cellcept for the lupus, and she also put me back on hydrochloroquine. I stopped taking it almost a year ago because it was giving me really bad diarrhea. I mean, TMI, but it was like 12 weeks that I had diarrhea. And it was so bad. I mean, literally from the time I woke up in the morning until the time I went to bed, sometimes in the middle of the night, I was on that toilet going to the bathroom. And it sucked. So anyways, I had gotten off that. Everything got better. They tried me on 2 other pills. They didn't work. And then they put me on the leflunomide, which the leflunomide has been working. But when I talked to my rheumatologist, I told her that I had had the shingles. And she's like, you got to stop taking the Areva, which is the leflunomide. And I'm thinking to myself, why do I have to stop taking it? And she said, I couldn't understand her because she's Hindu Indian and she's got, you know, a really broken accent. But I guess it has something to do with lupus and what I was taking and the shingles and that medicine. I don't know. So I stopped taking it. And she put me on the Cellcept. Oh, and then she's got me on prednisone, which I'm always taking prednisone. I've always had extra. So I'm on the prednisone again, which I've always have been on the prednisone. Can somebody tell me if with lupus patients, if you bruise easy? Because I swear I am starting to bruise even easier every day. I don't know where I got this bruise from, but I got a bruise on my arm, you guys. Right there. It happened like 2 days ago. It was really weird because it started turning colors really fast. It was all this, like at the beginning it was like this like silvery blue color. And then I swear within 2 hours it was like a reddish blue color. And then it was just red, and now it's dark. and this has been like 2 days. So I've never had a bruise that fast like that in my life. My feet have been really bad, but my neurologist had put me on extra Cymbalta, which is the duloxetine. I take the duloxetine, which is the generic form of the Cymbalta, and he put me on an extra, I think I was taking 60 and he gave me an extra 30, and that seemed to be helping with my nerve pain in my feet, but the nerve pain is still there. It's never, ever, ever going to go away. I mean, it's irreversible. I don't think there's a way to reverse it. I don't care if anybody tells me to eat healthier, and it's not going to go away, because I have damaged, in my right leg, I have damaged small nerve fibers, which will never, ever be better again. And I'm not going to have surgery on it, sorry. I'm not all about surgery. I'm not about going to the hospital and staying in the hospital. When I had the shingles back about a month ago, my regular doctor thought I was going to end up in the hospital because it was on my boob. Excuse me, you guys. It was on my breast, and it was on the nipple. It was on my side, and it was on my back. And the one that was on my breast started looking really inflamed and really, really dark. And she told me, she goes, I think you have MRSA. She goes, you're probably going to end up having to go to the hospital and get an IV of antibiotics. And I'm like, okay. So I'm like, okay, cool. And then when I found out that I was going to have to stay overnight in the hospital, I was like, oh, heck no. No way. So anyways, she put me on more of the medicine for it. I can't remember what it's called, you guys. And then she put me on more prednisone. And and the antibiotic, antibiotic of, I can't remember which one that is either, because it's been so long. It's been like 2 weeks. But anyways, you guys, it's all starting to heal. It's starting to look really good. So that's good. I mean, I had the shingles for like over a month, you guys. But I wanna go into more videos on lupus. I'm just trying to go over like my lupus story, and I know I'm all over the place. I'm really all over the place in this video because mentally, emotionally, and physically, I am so drained. I have been wanting to make this video for over a week now, and I haven't had a chance to sit down and take time for myself. And right now I'm taking time for myself, even if it's 15 or 20 minutes. I'm happy to get that 15 or 20 minutes, you guys. So, if anybody experiences weird, like, symptoms with their lupus, just leave a comment below and let me know how you deal with that, because I have a feeling my lupus is going to get worse before I can try to make it better. Now that, you know, I'm on this new medicine, I've been on Cellcept probably like 2 weeks now, and it seems to be going great. I mean, the pain, everything is still the same. I'm not having any side effects from it. And you guys, I'm sorry if I look tired, but yes, I am very tired. I can't wait until tomorrow morning, because hopefully I will be able to sleep in. And Sunday too. Because I'm telling you, getting up at 5 in the morning and going to bed at 11 o'clock at night is a killer. So, if anybody has any questions, if anybody has any comments they would like to ask or whatever, just leave a comment down below. And I'd like to do more, like I said, you guys, I'd like to do more videos on lupus and what we go through, and just kind of like a diary. I want to do like a lupus, like diary of a loopy. How about that, you guys? We'll call it Diary of a Loopy. So if you guys enjoyed this video, please give it a thumbs up. And if you want to come back and watch the rest of my videos, hit that subscribe button and then hit that bell button, the little bell next to the subscribe button, so you guys can be notified of any of my videos that I might put on in the next day or two or week or whatever. You know, I'm all over the place when I put my videos on. I don't know when I'm going to be able to pick my camera up and just talk, you guys. I mean, this right now is helping me just laying here talking, getting it out, and just it's relaxing to me. So you guys, I hope you have a great day. I hope you have a wonderful weekend, and I will see you in my next video. And again, you guys, make sure, leave any comments down below. I will answer anything, or if you just want to make any kind of comment, that would be great. Thanks. Bye.